Are you guys able to see my screen? Okay. All right. So first of all, welcome everyone. Good evening, and I'm going to talk about this topic of pandemics, vaccines, and global health. But before I start, let me ask you all a question, right? So obviously, with our recent history and in fact vast history of pandemics that have affected us, what do you think is the one common thing which links all of them? Well, it's not just the virus, it's the fact that it's a surprise. It is always a surprise. Well, most people think that a pandemic starts because someone coughs on a bus or is sneezing somewhere, right? But that's wrong. Most of the pandemics start because of animals. The diseases they get transmitted from animals when we cut down the forests and they are forced to move closer to us. Due to favorable conditions, the viruses are then able to affect us and stay within our bodies. So, technically, the climate change fight that we have and this pandemic prevention are the same fight. Now, all of us will remember the COVID lockdown days, right? The endless nights that we had stuck within the four walls of our houses and the constant news of, rising cases and deaths and all of that. It was a truly horrific time. But when we think about how it all started, how it reached a certain stage, that is what I want to show through this presentation today. Outbreaks like the COVID-19, like the recent hantavirus outbreak as well, they start small, very small. In fact, they start with one person, right? One person, one case, which goes undiagnosed. Now, the real danger, which was clearly seen during the COVID days, was that the numbers multiplied because the patients of COVID were treated in the same rooms as the other patients. Now, this isn't to say that the doctors were careless or they weren't taking enough, preventive methods. It is just that no one knew who had the virus and who didn't have the virus. Now, what's the main lesson that we can learn from this? It's that we need to pay attention from the start. That very first case matters a lot. Now, before COVID, many of us never thought about vaccines. And then the whole world was looking for one, you know. And here's the truth, vaccines didn't appear out of thin air, right? Scientists have been working on vaccines for decades now. And the way that these vaccines work is very beautiful. I have a small video to show you as to how these vaccines work.
Manu, we can't hear the sound.
Are you not able to hear the sound?
No.
Mm, one second. Are you able to hear it now? No? Okay, cool. No worries. Okay, so that was just a fun video I had for you guys. Unfortunately, no sound. So I'll just quickly explain how these vaccines work. Uh, so a vaccine is basically the same virus that is affecting all of us, but in a very diluted form or a weakened form, which is done through either heating or, other chemical methods. Nonetheless, when they are pushed into our bodies, it's like muscle memory. So once our body knows how to fight these weak ones, when the real viruses and disease affects us, it's very easy to kind of fight back. Nonetheless, I'll move on from this. Uh, so a wise man once said, "It's better to be safe than be sorry." You know, and this piece of advice is the backbone behind pandemic prevention, which has three main pillars, right? The first, as you can probably see, is surveillance. Now, what is surveillance? It is when you go around your neighborhood, testing the wastewaters, uh, tracking the cases. Like I mentioned, the first case, very important. Looking for people who get sick before the disease turns into a pandemic. Number two is stockpiles. We all remember those early lockdown days when there were no masks, no gloves, no ventilators. Everybody was running here and there, going crazy. And that happened because there was no proper stockpile. Being prepared for a pandemic means having all of these gears, having the gloves and the masks before the pandemic actually happens, not during. And last, but definitely not least, is trust. This is the hardest one to get. You can have the best surveillance, you can have buildings full of gear, but it won't work if there's no trust in the people. If they don't trust the advice that's being given to them, it won't work. A vaccine can't work if nobody believes in it. A health warning won't work if nobody listens to it. Trust is the one thing that can save us from a pandemic. Now, let me talk about the actual people who do these, the heroes behind the scenes. So, the first one being the epidemiologists, tough word to say, which is why I like to call them disease detectives, because that's exactly what they do. They go around, they, track where the sickness has started, how much it has spread, to whom it has spread, right? Number two, we have the vaccine researchers. These guys are the inventors, the ones who create the shield which protect us from these diseases. We also have the global health policymakers and the community health workers. These are the people who work in organizations like WHO, which is World Health Organizations, as well as CDC, which is Center for Disease Control. These are very important people who make up the rules and regulations as to what is to be done during a pandemic. And the community helpers are your everyday people, the ones around us who go about, help people, they spread awareness. The main thing is that these are the ones who build trust in the community. They are our first line of defense. Now, here's the best part about them. They weren't born in a lab coat. They weren't made for these jobs. They were normal people, students and neighbors, just like all of us. Some of them were probably interested in puzzles, or maybe they were curious about how viruses work and are transmitted, and hence they became our so-called disease detectives. Some of them could have been good speakers, or maybe just a people's person, which is why they become policymakers and community workers. So who knows, maybe one of you will be that one day, and I would love to see you at that spot. Now, coming towards the end of my presentation, I just like to ask a few questions. If you guys are comfortable, feel free to unmute and share. So the first question, if you see someone coughing and sneezing, say in your neighborhood or in a public transport, anywhere, what is the first thing that you can see yourself doing? Yeah, go on, Sanya. You guys can unmute and respond.
Okay, so maybe I'll use mask so to keep myself secure from the bacteria which is around me. Yes, please.
Mm-hmm. Okay, good. That's a nice answer.
Uh, I will try to use handkerchief to protect my face because it can affect me from my nose or from my mouth. So I will try to protect my mouth with handkerchief, please.
Yeah, that's an excellent answer. Okay, cool. Uh, let's move on to the next question. So, say you hear about this new sickness that's spreading in your area, right? We recently had the Hanta virus and the Ebola outbreak that's happening. So, what do you think is the first step that you will take for a sickness? Yeah, Mansi.
I will look at the way, like from this virus is being spread, and protect myself the bestest way I could.
Okay, it's a very nice answer. Anyone else?
Uh, yes, like it mostly depend on the virus. If the virus is spreading through the airways, so I will try to wear masks and I will try to take home precautions like uh, drinking boiling water and something like that. If the virus is spreading through the animals like chicken or something else, so I will avoid eating non-veg items and I will prefer veg things. So it depends on the virus, like how it is spreading.
Yeah, very well. I think some of y'all are already prepared to tackle the next pandemic. Okay. Uh, let's go to one of the most important questions, which is a debate all over the world right now. Is that, say someone is not ready to take a vaccine or they think that a vaccine is useless. How would you react? How do you think you can convince them of the otherwise? Say it's a friend or a neighbor or even a family member sometimes. Yeah.
First, I will try to explain that person pros of the that vaccine, and I will also tell that person the cons, like why he should not take it. But like obviously, since it's vaccine, pros will be better than cons.
Yeah. That's a nice way of speaking to someone, convincing them. Anybody else?
Yes, so I think like vaccines in during COVID or COVID-19 also some people were afraid to take vaccine and they were avoiding to take the vaccine because they got the fake news from that vaccine is affecting the body. So I will try to convince my friends or my neighborhood, like Mansi told, I will tell them the pros of vaccines, like this vaccine can help you in this, it will protect you from this virus. So I will try to convince him with the pros only. Yes.
Yeah, that's perfect. And thank you for bringing up that point. One of the main reasons why people say no to vaccines is because of misinformation. So, it is our job as a part of the next generation to spread awareness about this, to explain to people that no, viruses do, in fact, help us, right? Okay. So last question. I don't want you guys to answer this right now, but this is just something for you guys to think about and maybe start implementing it into your daily routines, which is based on all of the answers that your peers have given you and everything that I've told you in my presentation. What is something that you will do differently tomorrow? Right? And with that, I want to leave you guys with one sentence, which is pandemics are prevented by ordinary people who decide to take care before it becomes an emergency, right? You don't need a lab coat, you don't need a fancy degree. All you need to do is wash your hands, stay home when you're sick, take care of yourself, listen to the healthcare workers and the doctors when they speak about a disease, and stay healthy as best you can. Right? Thank you, guys.
Thank you, Abhimanyu. Urja, are you there?
Yeah.
Okay. Um, does anyone have any questions on what we just learned? Okay, so if no one has any questions, then Urja, can you try screen sharing?
Yeah, one sec.
Abhimanyu, you can leave the meeting now.
Okay,
Thank you.
cool. Thank you. Thank you, guys. Bye-bye.
Bye.
Can you all see my screen?
Yes, we can.
Yes, please.
Okay. So I am Urja Bhatt. I'm studying in grade. I'm actually going to grade 11 in Mount Litera School International. So I have a small question for you all. One word that comes to your mind when you hear the word help. Just type it in the chat box. That's all, or is there more? If it's like, if that's all, um, by the end of today, you will. So what is the main? Why am I here? First of all, so I am here because we are talking about something that affects millions of people, and women, um but they often, like, we don't notice it. That is iron deficiency and anemia. So by the end of today's session, you'll know how to spot the signs, which food actually help, common myths, and small changes. So, quick question, raise your hand if you ever felt tired even after sleeping well. Now keep your hand up if you ever skipped breakfast. Some of these habits can actually affect iron levels. So today's session is not a lecture. I'll be asking you a lot of questions and there are activities. So yeah, let's get started. So just type A, B or C in the chat. Anemia means low blood sugar, low iron or healthy red blood cells, or dehydration.
Usha, may you please repeat the three options again?
Low blood sugars A, low iron or low healthy red blood cells is B, and dehydration is C. That's all. So the correct answer is B. So the correct answer is B. DT. So now we will play a small game called Spot the Sign. So in this game, what you'll be doing is you will so next to the signs there are those names, but don't read that. I will ask all the signs and then you'll have to say the answer. So you can see, right, the first sign. What does that mean? Raise your hand and answer. Any of you. Yeah.
Yes. So the first sign says that the person is very tired and feeling sleepy.
Okay. And what does the last sign mean? Any of
The
you?
last sign means the person is suffering from headache, maybe because of like excessive sleep or because of less sleep.
Okay. So now, women. If you look at the statistics in India, the rural areas, the women compared to the men are at risk because of their periods, because of pregnancy, because of eating late, and because of food taboos. Now, what do I mean? Food taboos. Food taboos means that girls are sometimes told to avoid eggs, meat, or certain vegetables during periods. And that is the exact need that they need iron. Now, here, let's say your spinach, palak. Your palak can be one plant source meal. Your rajma can be one plant source. Your sesame seeds can be one plant source, and there are many more. Now, your vitamin C. Now, what does the vitamin C do? It doubles the absorption. For example, limbu, your lemon, amla is actually a very good vitamin C booster. Tomato, amrud, and green chilies. Now, you will be thinking, listen, what about tea and coffee? Because we love coffee, why can't we have it before the iron food? You can, because the tea and coffee blocks the absorption of iron, but you can have it like an hour later if let's say today for dinner I'm having palak paneer, or for lunch I had palak paneer, for example, and then before that I want to have coffee, and after that also I want to have coffee. So what I do is we have to take an hour break before and after. So now this is a case study. There's this girl called Dekha. She's a factory worker from Rajasthan. So now what is the situation? Now Rekha works 10 hours shifts at a textile factory. So every evening she feels like very lethargic to cook. She survives on chai, plain rice, and sometimes a small piece of roti. Her periods have become irregular and very heavy. Now, the problem. Rekha thought her tiredness was just from overwork. She ignored dizziness and the pale color of her eyelids. Her hemoglobin was tested 7.2 grams, which is severely with anemia. Normally it needs to be 12 plus. Now, after visiting an ASHA worker, Rekha started adding a squeeze of lemon on her dal every day, and that's what y'all can also do. Eating jaggery instead of sugar in her chai, taking prescribed iron tablets continuously for 3 months. Now, the outcome. In 3 months, her hemoglobin from 7.2 rose up to 10.8, and that is a huge rise. Her energy improved, concentration came back, and she started helping 4 other women in her building get tested. Now, this is activity 1. Now, drinking tea with your meal helps absorb iron better. So raise your hand whoever thinks it's true. Like just raise your hand and say true or false. Yeah? Okay.
It's false.
Correct. So why is it false? It's false because it contains tannins, which basically blocks the iron absorption. Now your spinach and rajma are good vegetarian iron sources. Yeah?
It's true.
So yeah, because these are among the best iron foods. So only poor or malnutrition women get anemic, like anemia. Yeah,
It's false.
False.
yeah, it's false. Even healthy looking women can be anemic. Now, eating jaggery is better than sugar for iron intake.
True.
Correct. Jaggery contains significant iron and sugar has none. Now, let's play another game. Now you're designing your meal. So my question to y'all is, what did y'all eat for breakfast in the morning? Yeah.
The normal omelette and roti.
So okay, what you can try is you can try poha with peanuts, or you can try one guava and one guava, or you can try besan chilla and with the vitamin C amla chat. What did you all have for lunch?
The normal dal, roti, and sabzi chawal.
What sabzi was it? Do you remember?
It was bhindi, ladyfinger.
Okay, so if it was bhindi, you all can also try rajma chawal, palak ki sabzi, and nimbu with the palak sabzi. Or you can try dal makhani, roti, and tomato salad. What did you all have right now for snack? Anyone? Yeah.
Momos, please.
Momos.
Yes.
You can try because I honestly love momos, but momos sometimes is fried. So you can try jaggery with chicky, or you can try sprouts with lemon and tomato. What will you all have for dinner later? You all know? Yeah.
Uh, dal makhni, rice, and paneer, butter paneer sabji
Okay, so I
for the
think
dinner.
you have taken my dinner ka option. Because I was thinking y'all could have methi paratha, dahi, and sesame chutney.
Hmm.
Or y'all can have moong dal, khichdi, and green chili. Now, your affordable iron guide, right? Every rupee counts. So, if y'all go to, let's say I have a friend, I don't have a friend, but let's say if I have a friend who is anemic, and I tell her ki you go to a restaurant, for example, and they serve palak, rajma, chana, sesame matlab til, jaggery and mungra. These 6 things they serve. Now for palak, the iron content is 2.7. The approximate cost is 10 to 15 rupees a bunch. How will you all eat it? Yeah.
I will make palak ki sabzi.
Um,
Okay, so Anya, you other one.
so my mom's make palak ki dal.
So what you can do is, you can have dal palak and also paratha or saag. Now if you have rajma, now what will you do? 8.2 is the grams to 100 grams. Now you have 20 to 30 rupees and you have 250 grams. Now what will you do? With rajma. Yeah.
We can have rajma ki kadi and roti,
You
normal
can
roti.
also roti and also you can have it with limbu. Because
Hmm.
limbu gives you your iron, your vitamin C alternative. Now if you have chana you have 6.5 grams. You have 100 grams. You have 15 to 25 rupees. Now what will you do? Yeah.
We can make sprouts and also chane ki sabzi and yes, like chana masala as we normally eat.
So you can eat chana masala sprouts. Now if you have til, sesame. Yeah.
We can have tilke laddu,
Hmm.
which will contain jaggery as well.
Tilki laddu, in my opinion, if you're talking about iron deficiency, is the best, in my opinion. So yeah, these are few other like horse gram or mungra or good. These are few others. Now, so these are there are few myths that have been busted. Please don't be fooled. One is spinach has very high iron and just eat lots of it. The fact is, okay, chalo, spinach has iron, but also oxidizes that reduce absorption. Now, if you pair spinach with vitamin C, it will give you a best result. Now, iron supplements are only for sick people. That's a myth. But the fact is, WHO recommends iron plus folic acid supplements for all adolescent girls in high prevalence countries like India. I think yesterday I read a statistics that 40% of the village girls don't get they they have houses but they don't may have fresh palak. Now, if you look healthy, you can't be anemic. That's a fact. That's a myth, my bad. Fact is, many anemic women appear fine. Only a blood test confirms anemic. Now, myth can be girls should eat eggs during the period. Fact is, eggs are an excellent source of iron and protein. This restriction is a harmful myth and you have to eat them. Now you're like, oh, yeah, now I've just become an anemic when I went to your doctor. Now, if your hemoglobin, so you have to seek help immediately. If you experience your hemoglobin below 8, that is severe anemia, fainting and a loss of consciousness, heart palpitations at rest, extreme breathlessness during minor activity, and swollen feet. Now, if like in India, where will you find free help? Your ASHA doctors, your AM workers in your village or colony, and few others. Now, your 3-step action plan starts today and it needs to start today. Your step 1 is to eat smartly. Let's say I love pizza, but then my mom like, Ujja, I have to eat palak, Ujja, I have to eat this. Chalo, eat your pizza, eat your fries, but make it a habit that you have to eat palak. You can also put lemon on dal, jaggery instead of sugar, spinach in sabzi, eat guava in evening snack. Now you have to stop one habit. That is step 2. What do I mean? Like stop habit, matlab don't like some physical activity, like do your physical activities. Stop drinking chai or coffee right after meals for just 7 days. Now because of the heat, in my bottle, what I put is in the morning. Because now I'm not home until what, 4 o'clock, 4:30. In the morning, I put, and after I come back from where I go, I put thanda, nimbu pani, or you can put ginger and tulsi tea with no milk and plain warm water. If you do okay, don't do this ginger plus tulsi and plain warm water. Just put limbu pani in your bottle for 2 weeks and then you'll see the difference. Now the last step is to get tested. Ask a Ashad worker, PHC, or any doctor for a free HB test. Now HB meaning your hemoglobin number. Please know your hemoglobin number. If your hemoglobin number is 12 plus, it's normal. If it's 10 to 11, if it's 10 to 12, it's mid anemic. And if it's below 8, it's severe. Then decide the next step with the doctor. So yeah, this is it. So one thing you have to remember is anemia is common. If you have anemia, you can't run away from it. But it is not normal. You deserve energy, you deserve health, and you deserve to thrive. Now, today's 3 takeaways: add iron-rich food, vitamin C, skip chai right after meals for better absorption, and get your HB tested. So that's it for today. Any questions does anybody have? So I think I'm done.
Okay, so if no one has any questions, then we'll end the session here today. Thank you, everyone. Thank you, Urja.
Thank you.
Thank you.
Thank you, Usha. Thank you.
Thank you.
Oh, Mansi, do you have a question?
So,
I just want to share one thing. I have heard this myth. Like my sister have habit of having lemon with everything, dinner or meal, whatever she has.
Yeah.
So people around us always say that it's not good for us to it's not good for us to have lemon with everything you eat.
Yeah.
So
I
it's my yes, please.
might might be that it's not good to eat with some of the things. So it's better to like cross check always.
Okay, thank you.
Thank you. Thank you, everyone.